Welcome. Have you ever felt that sudden, uncontrollable urge to urinate? Does it happen frequently, disrupting your day and making it hard to focus? You might be experiencing overactive bladder, or OAB. In this video, we'll explore what OAB is, its causes, symptoms, and how it can be managed, helping you regain control and improve your quality of life. So, what causes this frequent urge? The exact cause of overactive bladder is often unknown, but several factors can contribute. These include nerve damage from conditions like stroke, multiple sclerosis, or spinal cord injury. Certain medications, excess weight, age-related changes, and even infections can also play a role. Sometimes, even simple things like consuming too much caffeine or alcohol can trigger OAB symptoms. In some cases, no specific cause can be identified. Let's delve a bit deeper into how OAB actually works. Normally, as your bladder fills, nerves send signals to your brain, indicating the need to urinate. In OAB, these signals become erratic. The bladder muscles contract involuntarily, even when your bladder isn't full. This creates that sudden, compelling urge to go, often multiple times during the day and night. This is sometimes referred to as detrusor overactivity. Overactive bladder is a common condition affecting millions of people worldwide. While it can occur at any age, it's more prevalent in older adults. Studies suggest that women are slightly more likely to experience OAB than men, though both genders are significantly affected. It's important to remember that OAB is not a normal part of aging and shouldn't be ignored. The hallmark symptom of OAB is a sudden, strong urge to urinate that is difficult to control. This urge is often accompanied by frequent urination, typically 8 or more times in a 24-hour period. Many individuals with OAB also experience nocturia, which is the need to wake up and urinate multiple times during the night. In some cases, the urge can be so intense that it leads to urge incontinence, which is the involuntary loss of urine. Diagnosing overactive bladder usually involves a thorough medical history and physical exam. Your doctor may ask about your symptoms, fluid intake, and any medications you're taking. They may also recommend a bladder diary, where you record when and how much you urinate. Urine tests can rule out infections or other underlying conditions. In some cases, more specialized tests, like urodynamic testing, may be performed to assess bladder function. While there aren't distinct types of overactive bladder in the traditional sense, OAB is often categorized based on whether it is associated with urge incontinence. If you experience the strong urge to urinate and leak urine, it's often referred to as wet OAB or OAB with urge incontinence. If you experience the strong urge and frequent urination, but do not leak urine, it's called dry OAB or OA without urge incontinence. Managing either form is important for overall well-being. Fortunately, there are several effective treatment options for OAB. These include behavioral therapies, such as bladder training and pelvic floor exercises like Kegels. Medications, such as anticholinergics and beta-3 agonists, can help relax the bladder muscles and reduce the urge to urinate. Lifestyle modifications, like limiting caffeine and alcohol intake, can also be beneficial. In more severe cases, advanced therapies like Botox injections into the bladder muscle or sacral nerve stimulation may be considered. While you can't always prevent OAB, certain lifestyle modifications can reduce your risk or manage symptoms. Maintaining a healthy weight, practicing pelvic floor exercises regularly, and avoiding bladder irritants like caffeine and alcohol can be helpful. Managing underlying health conditions, like diabetes, and addressing constipation can also contribute to bladder health. The prognosis for OB is generally good. While it's often a chronic condition, it can be effectively managed with appropriate treatment and lifestyle adjustments. Recent research focuses on developing more targeted and less invasive therapies for OA. For example, new medications with fewer side effects are being explored. Researchers are also investigating the role of the gut microbiome in bladder health and potential therapies based on modulating the gut flora. Staying informed about the latest advances and working closely with your healthcare provider can significantly improve your quality of life with OB.